If it's 2 in the morning, you do your best with the hemodynamic parameters you have available to you from your SWAN, etc., to try to make that decision. You'll increase the inotropes, you'll give volume, but why do all that and get to a point where you might have a patient almost arresting before you have to open the chest? Why not just have an easy answer?
It's often hard to tell with hemodynamics alone whether a patient is having a problem with the right ventricle, with the pump itself, or whether tamponade or bleeding is a factor.
Even just a brief episode of hypotension can result in a prolonged ICU course and a prolonged length of stay and significant mortality and morbidity for our patients.
So complex patients require some form of continuous management. Cardiac performance is related to hemodynamic stability. Any level of hemodynamic instability is associated with higher mortality. At the same time, it's not so simple that you could just look at a filling pressure like a CVP and know what it is that you need to do. What we've developed is a miniaturized, disposable transesophageal echo probe. As the world's first hemodynamic TE device, this Clarity probe provides the ability for physicians to directly visualize a patient's cardiac function over a period of time, but in addition allows them to manage multiple patients in the ICU over a period of time. One of the main optimization that's been done here is to have a very small, thin, and flexible probe. So this probe is about the size of a 17 to 18 French OG tube. It allows the physician to leave this probe indwelling for up to a maximum of 72 hours. Having the capability to leave a TE probe indwelling for up to a period of 72 hours opens up new ways of managing patients' hemodynamics. One of the features of the hTEE system from ImaCor is you can bring up on the screen a split view and look directly at what the patient's heart size and function looked like an hour before, when you were changing some intervention like fluids or pressors and such, and then compare that directly with what you're seeing right now. That's very powerful to be able to wean off pressors faster. It gives a great deal of confidence. You're not looking at surrogate information, you're looking at direct information, so it's much easier to get to the right answer faster, more reliably, and repeatedly, and therefore getting the patient out of the ICU faster, getting them off of circulatory support faster, and this should translate into lower length of stay and lower cost of care for those patients.
We find that the hTEE probe is a significant tool in the assessment and management of these patients.
In order to really optimize your patient, the better resuscitation you do is the faster resuscitation, and to get there fastest, I think you really need to have an understanding of where you are real time, and I think hTEE really helps you do that.
We can make a difference in the critical care population if we use it as a standard of care.
No one will argue that it's better in these situations to have the answer sooner rather than later. The reason why I think this is such an important investment is not only because of what I've seen it can do to improve our outcomes, but because I really foresee that this will become standard of care. I think that the hTEE probe definitely helps you make better decisions faster.